Without a doubt, you've heard of tennis elbow, but do you know what it is and what it isn't? In this video, I'll explain what the injury is and clear up a common misperception that can lead to suboptimal treatment, as well as talk about what treatment options can help you overcome it quickly. My name's Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I hope you feel, look, and perform your best regardless of age or injury. Now, tennis elbow is nicknamed that, but it's actually more often than not tennis players that get it. Now, tennis players definitely can get it, especially more beginners and people just starting out, but you can see it in all kinds of manual laborers and people that type a lot. What it is it's a problem of the muscle and tendon, that basically attaches to the muscles that extend the wrist and extend the fingers. Those tendons attach to the bony prominence right there, the lateral epicondyle. Now, it's not an inflammation of those tendons. That's a common misperception. What it actually is, if you get an MRI or you to cut it open surgically, you won't see inflammation. What you're going to see is a small area of degeneration within that tendon, what's called a tendinosis or a tendinopathy. And that's what makes it a little tricky to heal. And that's why treatments that have been used for a long period of time, like anti-inflammatory medications and steroid injections into that, typically actually have inferior success rates to other treatments that are out there. And really, I'm a big believer in avoiding, especially cortisone shots for tennis elbow. Typically, this is not something that needs surgery. Lateral epicondylitis or tennis elbow typically heals without surgery. That can be physical therapy and some efforts to try to increase blood flow to that area. That can be, there's a strap that some people wear to take pressure off of that tendon while you're doing something physical like playing sports. That can be a number of other treatments. And that's where sometimes regenerative treatments are popular, things like platelet-rich plasma, even exosomes, which are obviously considered experimental by the FDA, but may help that tendon heal a little more quickly. There's modalities. People try things like shockwave treatments or red light or laser therapy, low-level laser therapy to try to get that tissue to heal. But typically that can do well without surgery. Maybe even something, the peptides, the BPC 157, thymosin beta-4, TB4, some people call it TB500. There may be a role for it there. Again, all those regenerative treatments are considered experimental by the FDA. I'm not promoting that. Just I have a lot of people that ask about it. And so if you are interested in that for your tennis elbow, definitely talk to your doctor, see if that's a good option for you. Having said that, occasionally they do need surgery. If none of that other stuff has worked, and I really haven't seen that, especially if you don't do a lot of cortisone shots or you haven't had a lot of cortisone shots, the success rates are very good. But occasionally, if nothing's working, you can do a surgery where you go in and basically cut out that diseased part of the tendon and either close it back down, or if you had to cut out a lot of the tendon, pulling it back up to the bone and reattaching it with stitches and anchors can be necessary. If you do go through a surgery, it does have good success rates, albeit a little bit of a recovery period that takes a while. But again, fortunately, it's a problem that usually heals with non-surgical treatments, whether that's the conventional counterforce strap, physical therapy, things like that, or more of the regenerative things. But hopefully that's something that you can avoid surgery for. Now, if you've had tennis elbow or some other elbow injury, I'd love to hear your experience. So please leave those in the comments below this video. Just understand, I can't give you medical advice if you ask for medical advice with a question in the comments. So what I do is I typically take that topic and discuss it in a future video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video or start a new live stream like my Ask Dr. Geier Live shows. Thanks so much for watching. I hope this video was helpful for you. I look forward to helping you feel, look, and perform better than ever.